Now we move on to our third session, and that's one called self-care for physical and mental well-being. I would like to invite the chair of the session, Janet Kepper. Janet Kepper is the advisory board member of World Fitness Alliance. He is also the president of Estonian Inflammatory Bowel Disease Society. He has done a lot in the field of digital healthcare, as well as he has worked for the Estonian Chamber of Disabled People in various working groups and councils, including his role as a member of the Ethics Council at North Estonian Medical Center. So over to you, Derek. Yes. Sorry, you can when you guys online. No, you don't.
And the third session will talk about the best practices. We saw and our third session will be focusing on the best practices. We heard already that there is a declaration and there is the expectation, and now we are trying to understand how this all come to real life. And the plenary presentation will be from policies to practice, scaling up the self-care intervention for NCDs and Europe. And the speaker is Manjula Narasimhan, lead self-care of health and well-being, WHO. And she's from online, so the floor is yours.
Yes, hello. Can you hear me?
Yes.
Yes.
Can you see me? I don't know.
Just trying to figure that out.
I mean, I can start while,
Manjula, your camera is off.
I see.
Yes.
You see me now? Okay. Hello, everyone.
The slides from there.
Hi. Will you be showing the slides?
You just have to click here. Yeah, you can see.
I can't see my slides, but yes, I can hear you and I can see.
So you should be able to see the slides as well.
Okay, I can see the main slide. It's okay. I'll start and then we'll just keep going. So firstly, Hussein, thank you so much for inviting me, and thank you to the whole the World Patient Alliance. It's really an honor to be back speaking at this conference. I think it's really it's exciting. It's in a world where there's so much uncertainty right now and talk of funding cuts and conflict and everything. There's for me a glimmer of hope and work that can be positive and affect both people, communities, patients, and that's improving the self-care. So this is an area that's really dear to my heart, and where there's really a lot of movement and a lot of interest from many partners. So I was asked today to just provide a little overview on talking from policy to practice, how some of the WHO tools and guidance that have been developed has helped this field. And also I'll provide perhaps a little bit of context on what we mean by self-care, from WHO, and provide some examples specifically around mental health and well-being and NCDs. So yes, great. So this is a slide many of you may have seen before. It's really to demonstrate that self-care is the first line of action for all healthcare, and we've known this for a long time. We know that this is an area that can improve autonomy and agency. We know that it could be cost effective. It doesn't replace care that's given in health facilities. It's complementary to it. It's not meant to replace, particularly for patients who need care in health facilities. But it does serve as a basis of a lot of the actions we have, and increasingly there are more and more interventions that can serve the self-care elements. And I wanted to add, I was just listening to the previous session as well. I wanted to add that, currently the health system is not really set up to serve all the people. We simply don't have enough qualified medical professionals, whether they're pharmacists or doctors or nurses or midwives. And in a time where, that's been the case for some time, and in a time where there's, increased funding cuts, an increased number of people facing sort of humanitarian crises, we really need to rethink how we are delivering services and what that means. So, self-care, it has always become there. It's always been there. It has become more visible. It continues to be important. And when it's done correctly, it can be rights affirming and empowering. And self-care really, we know it improves the autonomy and agency, but it's important for people who are not patients, the patients themselves, and also for the carers. So it's really something that is relevant and for everyone. And I'm sure each of you, we already know this, and I think there's been conversations around this in this forum before. We also know for a long time that self-care is a crucial component of managing NCDs. And that includes fostering self-awareness and responsibility, but allowing patients to better manage their conditions and achieve their full potential, despite the health conditions that they might be in. Next slide, please. Just again, this is for us the terminology that we use at WHO. Dr. Tedros, our DG, recommends self-care interventions for every country, every economic setting, and it is seen as a critical path to reach universal health coverage, to promote health, keep the world safe, and serve the vulnerable, people who are generally underserved by the current health system. And self-care is a very broad term, and we know it. It's here. I'm just going to read this out. It's the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness with or without the support of a health or care worker. And we look at interventions and actions as tools to support self-care. A lot of the biomedical interventions, and there's more and more of them coming onto the market, some of them generic products, but there are more coming to the market that that are tools that could be medical devices, diagnostics. There are drugs, over-the-counter drugs, and many of these are increasingly being used through digital adaptations as well. So this is sort of the framework or the terminology that we use at WHO. I know that there are different variations to this, perhaps in your own context, but this is just to give the context of the rest of the slides, and this is how we are framing it. Next slide, please. And the WHO developed the first global normative guideline on self-care in first time it was published was June 2019, and it was a few months before COVID hit. And while we knew this was going to be important, the fact that COVID happened so soon after the guideline was published, I think triggered in the minds of a lot of governments and partners that it is really important for us to trust and value the patients, the people who are in need and who can also contribute to this health delivery process. It was a silver lining at a very dark time for many of us, but the guideline itself really emphasizes people-centered care, person-centered care, and it focuses on organizing health services around the needs, the preferences, and the values of individuals rather than diseases. It is about the empowerment of people. It's about the empowerment of communities, and the recommendations that are in there and the language and the text that we have attempted to use was really about promoting the role patients and people and caregivers have in their health, in coordinated and providing continuous care, ensuring respect, ensuring dignity and compassion in all of those interactions. And it's very much prioritizing, quality and equity and collaboration and those partnerships with the patients. The objective of a lot of the WHO guidelines is about strengthening health systems, but this particular one is also about strengthening people-centered care and the care of the overall health outcomes and well-being outcomes. So that's just again the framing of this guidance. And the next slide, please. And here, in allowing patients and people to care for their own health, to make those decisions, we do need the health system, we need the healthcare workers to trust and work with the patients. So the self-care competency framework, it's a three volumes. It's really about establishing some standards of care for health workers themselves, but also in their in the way they interact with patients. And in the next slide, we see I've only outlined here the first volume. For want of time, but I can go back and explain some of the other two volumes. But it's really about so the key competencies that health and care workers are going to need to enable self-care. And we've got here 10 key competencies, and these are explained more in detail. There's some specific examples around NCDs, and it provides the basis for enabling health workers and care workers to communicate better, to collaborate with the patients, to communicate with each other among different cadre of health workers, to look at where the evidence is and to provide information that's evidence-based of self-care practice. And in a time where there's a lot of misinformation, and this is actually really important for us to keep grounding in the science, in the evidence, so that people have the best knowledge and the best information they have to be able to process the decisions that they need to take. And there's I won't have time to go through all the competency standards, but we now have the basis for health professionals to be able to support self-care better. So I'll leave it at that. And so the guideline that we have, it was something that was catalytic for many governments to push forward a self-care agenda. And in the next slide, I'm just highlighting that within 5 years of publishing that guideline, what we are seeing is that over 50 countries have changed their national policy to, just the next slide, please. Have changed yes, thank you. Their national policies to include self-care. So these are, the text here is too small, so I don't expect you to read it, but just for you to see that, we're starting to document what these case changes, case studies look like, where the emphasis has been, where there's been some cherry picking, and they've chosen a few self-care interventions over others, some populations that are being prioritized over others, but overall, there are clear examples of guidelines across all the regions where there's a change in health policy. There's a national self-care strategy. There's a national self-care guideline. There is inclusion of self-care within the work plan for the next year, reaching towards SDGs and going beyond. So there's and that, you know, in this map is, you know, we see a lot of low and middle income countries where WHO primarily works, but we are also documenting what's happening in Europe and in many of the high income countries, because it's quite clear that this is going to be relevant across all economic settings, as I previously mentioned. So I'm just going to shift here to focus more on mental health. And so the next slide, and you may have already seen this, but quite recently this year, the Euro country office, regional office of WHO, produced a policy paper on scaling up mental health within the primary care, and you know, going through that, it's quite clear that the paper really argues about the importance of taking care of patients early on and reducing the stigma, reducing waiting times, helping people improve their health and well-being across their life course, so that it's not just a one-off thing, but something that they are supported at many stages of their life, or as much as they would need to. So there's some real strong and supportive language around shaping this policy agenda for the European region. Next slide, please. And the self-management here, you know, can support, you know, the focus on this document is primary care and for primary care workers, but it is about guiding individuals to utilize evidence-based self-help tools. It's about using, for instance, digital self-help tools and group-based stress management courses, just as some examples. But it's also about providing psychoeducation and counseling, evidence-based, you know, psychological interventions, and for these to be delivered as part of various mental health situations, such as depression or anxiety management. In addition, in some of the countries, primary care can direct patients to various organizations that offer assistance with issues such as debt or marital or relational problems or various addictions. So again, this is the framework that was used for the European region. And one example that's going to be available quite soon, it's going through the various publications, and some aspects of it are available. It's in the next slide. WHO has developed, next slide, please. WHO has developed a digital self-help tool for mental health. And this tool really will focus on digital and guided self-help that for patients and for health workers. Next slide. So just to give you a little bit of context here, this is a work that's been happening for many years, and you see a lot of the tools that have already been that are already available at the bottom of the screen. But it's really aiming to provide the resources and support to bring psychological interventions to scale. And it's all open access. It's available on the WHO website. It's available in a range of languages, and it's based on the evidence. It's based on many randomized control trials, which is often seen as a very high quality evidence. And there's this big focus on the digital interventions. So there's implementation manuals that will be made available quite extensively. The next slide, please. And some of the key features here, you know, it is available to use now, and I can share this. And I really thank my colleagues in the mental health department, and Ken Carswell in particular, who was one of the leads to work on this tool. And some aspects of this is like there's a transdiagnostic tool aimed at a range of mental health issues, including psychological distress, anxiety, depression. As I said, it's available in over 30 languages. And it really is intended to be a self-help book, to be adapted and support, the therapeutic process. There are, if you go to the next slide, please, let me just, I don't know. Yeah, so again, this is, it has a step-by-step process. It can be, you can do it in a shorter time or a longer period of time. It's also important for the caregiver skills training and caregivers of children with, for instance, with developmental disabilities or other patients. And it can, it is a platform that can be adapted. So we're not saying that this is the end all, but it's great to see that new tools like this are becoming available. They're being done in collaboration with many partners, and having it based on the evidence, the latest evidence, can really help. We hope the patients and the people caring for them. Next slide, please. And some of the other pieces coming in 2025, as I said, there's an introduction to guided and unguided self-help. This sort of outlines our WHO strategy around this. It's there's links to message support from trained sort of non-specialist helpers as well. There's a focus on coaching, on motivation and support, and it aims to reduce sort of the resource use. So we would have less time, like an hour, maybe an hour 15 minutes, compared to normally 5 hours or more from conventional interventions. So and also perhaps less training may be needed, but that training would still be grounded in the latest evidence. And these are scalable models that have been demonstrated in a number of countries, and really are there to support the, again, as I mentioned earlier, a people-centered approach, a patient-centered approach, and supporting them across their life course, across various life stages, and improving equity in access and coverage. I think, yes, and the next slide, we really emphasize that content is key and that open access is key, and adaptation of this in the local context would be really important. So these are tools that are available to support the normative guidelines, the normative resources, from not only the health system side, but for the patient side as well. And I think that's my last slide. And next slide, please. Yes. And thank you so much. Thank you for allowing me to provide this context. And I really look forward to hearing from the other speakers on this panel. Thank you.
My pleasure to invite the other panelists. We have Jurata Sarkaite, DG Association of the European Self-Care Industry, Veronika Vanchikova, Executive Director and Chair of the Board, Slovak Chrome Club, and Dr. Cristina Pedrono Delgado, Coordinator Research Department, Advocate Alzheimer and Caregiver Association Spain. And let's start. I know from your presentation you mentioned also digital tools. Would you talk about more about those which I've mentioned, because the artificial intelligence are Can you hear us?
Sorry, I can't hear.
Can you hear now?
Just a second.
Okay. Yes, I wanted to start with you because you mentioned in your presentation those digital tools. Can you talk a little bit more about them?
Manjula, about the digital tools?
We can't hear you. Very low voice.
Just a second. Can you hear now? Can you hear now?
Yes.
Yeah, so your question.
Just to continue your presentation, you mentioned digital tools, and as we're already using artificial intelligence in our everyday life, can you talk a bit more of those tools you are presenting us next years?
Manjula, about the digital tools you mentioned in your presentation.
Yes, so is that question towards me? Sorry, I can't see the
Yes.
I can't see the
Yeah.
panel anymore. The I can't hear very well, and I can't see the panelists. So, oh, there we go. Okay. Sorry, can you hear me?
Yes, we can hear you.
Yes. So the question was about the digital tools. Is that correct?
Exactly.
Yes. So, you know, one of the other ways that, I mean, there's so many apps now, and you know, this is going to be pretty much the future. You know, our self-monitoring of conditions, the smartphones, smart, you know, watches. Just you know, there's a range of tools now. But in terms of guidelines and translating evidence-based guidance into smart guidelines. There is a range of digital adaptation kits. So these are ways to adapt the these are ways to adapt the guidelines from WHO to platforms that countries can use and translate the evidence into a digitally adapted form. So these digital adaptation kits have been done for many of the guidance, whether it's HIV. They haven't been done for any NCD areas, but they have been done for some of the other communicable disease areas. And more recently, we have done one specifically around NCDs. So for self-monitoring of blood pressure, there is a digital adaptation kit that is provider-facing, and another one that's been published this year that is client-facing. So both of these are working together for these tools to help the recommendations that we have in the guidelines to be used quickly and adapted more quickly at country level. So these smart guidelines are going to be pretty much the future, and will be rolled out at the same time as the hard copies and the PDFs that were the traditional documents that we used to have. Okay.
Thank you. And now back to this. Let me ask what kind of self-care practices we better integrate international with strategies to support physical and mental?
Okay, thank you. So thanks a lot for the question. And I think Manjula already talked about some great progress that we observed around the globe, but also in the European region, where governments start to understand the value of self-care. And I think COVID was a great accelerator of that, because we were all told to stay home and do what we can. And I think building on that, I would like to see more progress going further, because I think we are trying to invent the systems and make them fully self-care. And I think the objective should be to build the systems that encourage self-care. So I know it's a difficult goal for the governments to start thinking and to reimagine their systems rather than trying to add on systems that are. And I think some of those actors are very obvious. It's your medical doctors, it's the pharmacists in your pharmacy, it's members of your communities, it's the patient organizations. and also people themselves. And I think all those actors have to be encouraged. So building on some of the conversations which we had in the panel before about making sure that the patient organizations are well resourced and they can be these educators that can encourage their communities to do more self-care. But I also want to point out some of the practices that we are observing around the European countries where, for example, insurance funds give you, say, 50 euros that per year you can spend on your non-prescription medicines and other self-care products that you might need in your self-care journey. And I think these incentives, so we need to build systems that are actually encouraging and facilitating self-care, and also we need to make sure that we have the right incentives for all the actors that might be involved in the self-care to make sure that they actually promote and do the right thing. Thank you.
Veronica, what is the main challenges of the patients in Slovakia to maintain that physical and mental well-being?
Thank you very much for the question, and thank you very much for inviting me here. So I'm here as the president of Slovak Crohn Club, which is the organization taking care of IBD patients, or in other way, Crohn's disease and ulcerative colitis. I'm also the patient for 15 years. And there are a lot of challenges we need to face in Slovakia. When we talk about physical and mental health, it is mainly issue that unfortunately, we're facing a lot of depressions and anxieties during our diseases, because when you have relapse, not remission, then you need to stay at home. And again, as during the COVID time, we were kind of making a joke like, okay, now people, you see what happens to people with chronic disease staying at home as a prisoner and going out, because, for example, for IBD patients, you really need to be in a close distance with the toilets, and you cannot kind of plan your day because of different things and issues you need to face. But you really need to see not only gastroenterologists, but let's look at it from the multidisciplinarity. We need to see rheumatologists because of some problems with joints, with the dermatologist because of the skin issues, and the very the most important specialists, it is psychologists and dietitians. And this is the biggest biggest challenge we need to face in Slovakia, because if you want to see these two specialists, you need to pay for them. This is not covered with the public insurance. And then if you do not have money, you do not see it. And what does it mean? Then you are at home, you are not communicating with your family, with your friends, you are not going to school, you are not going to work. And then unfortunately, sometimes it has even the worst impact, the worst impact. You commit suicide, etc. So not only IBD patients, but I believe the other patients with chronic disease, they really need the psychological support, and let's provide them this support. So this is the biggest challenge.
We all, as patients, we all want to see in a good mood the doctor, caregivers, and everyone. What do you think? What kind of mental and physical strategies should caregivers and some implement to be fit themselves, because it's a big job for everyone.
Thank you for this question. Caregiver and staff supporting people, for example, with Alzheimer's diseases, can prevent emotional burnout and maintain well-being through, for example, physical self-care, regular exercise, stretching, or yoga to reduce tension and improve energy, maintaining and balanced proper hydration, for example, mental and emotional self-care, practicing mindfulness, meditation, or deep breathing exercise to manage stress, structured routines using planning and time techniques to balance work and personal life.
I have a question for Graham. How can you listen to organizations like Solar Project to develop and bring all of the patient people with you IBD to better manage their own self? It's your question.
Yeah.
As the second question, how can patient organizations like Slovak Chrome Club support and empower people with IBD better manage their own well-being?
Okay, so in Slovakia, we together actually with Czech Republic, we have the mobile application. It's called IBD Under the Control, and you know that some chronic patients need to take care and manage the disease every single day. So you need to, I don't know, write down what you eat if it doesn't affect your health. I mean physical. So for example, this like digitalization, as Manuela said, could be one option, how to manage and how to support people living and managing your health and disease every single day. Of course, when you are under remission, then that's perfect. You don't have to, but still you need to realize and educate yourself. So why are we here? Probably a lot of us are patients, and we are here because we want to educate ourselves, and then we can educate other patients in our countries. So let's make it somehow even official. As in the previous panel discussions, they said, let's legalize it, put it into legislation that patient advocates and organizations should have the right voice in the committees and advisory boards. So this is the way how to put all the patients together, educate ourselves, but also it's great to interact with specialists, GPs, and everyone who take care of us, because they need to hear it too. They don't have time in ambulance or hospital to talk to you from the moment you come until the end, because they have a lot of patients. And also somebody mentioned it in Poland that they have like 5 minutes for each patient. So let's educate ourselves, but also together with the doctors and nurses. Don't forget about the nurses. So this is, I think, the way.
How can your organization promote the culture of self-care among caregivers and staff to ensure the long-term resilience and motivation outside my care settings?
Organization can foster resilience and motivation by workshop on stress management, self-care techniques, and recognizing signs of burnout, and creating supportive policies. For example, offering access to mental health resources, employing assistance program or wellness initiative, recognizing and valuing staff contribution. For example, establishing recognition program to show appreciation for caregivers for modeling self-care from leadership, leader demonstrating prioritizing self-care, set on standard for staff.
Manuela, I have a question for you too. You mentioned that many countries have amended their national policies to self-care options. Can you give an example to how self-care intervention could support countries reaching national goals and targets? Can you give an example of how self-care intervention could support countries reaching national goals and targets?
Okay. Yes. So maybe just to what? So you're asking one example from how self-care can reach national goals and targets? Was that the question? Okay. Sorry. Well, I mean, there are so many examples now of how self-care options are being used at country level, and one clear example, for instance, is HPV self-sampling. So for screening for cervical cancer, there are now tools that women themselves can take, their own samples, send it in to either the lab or and they can get their results back on their phone. This has been shown to be actually that the women can do equally well in taking samples, or even better than at a health facility. And so for communities or women where who are not accessing cervical cancer screening, and it still continues to be one of the leading causes of deaths among women, it's these self-care interventions have been shown to help countries reach their goals and targets. And Increasingly, when there is conflict, when there are humanitarian situations, when there are refugees and migrant populations, we are going to have to rely on self-care kits or products that can be used by these communities, because just counting on existing health facilities may not be sufficient in those situations. Thank you.
And question. What role do self-care products such as OTC medicines, food supplements, and medical devices play in empowering individuals to manage minor health conditions and prevent escalations?
Yeah, so I was sitting actually at the back of the room with a colleague who is coming from the airway disease group. And I think he hopefully can confirm that if you don't manage your allergy well, you actually are going to aggravate your asthma condition. And we have the simple solutions that you can find in your pharmacy that can actually help you to manage your allergies, especially when the season changes or when you actually are coming in touch with the known allergens. And I think this is only one example that I can come up with. I mean, many of people living with the chronic conditions will have that certain nutrient lack because of the condition which they have. And expecting that they will have sufficient nutrients coming from their regular diet is just not realistic. I think many of us are realizing the value of actually looking into the nutrient levels that we are consuming with the chronic conditions. Talking about medical devices, I think some of the diagnostic examples that were given is really a good example of how to empower people to actually manage their symptoms and also detect some of the diseases quite early. One of the things that I wanted to bring to the table is as well that Manjula showed sort of the pyramid of the care. And I think this pyramid is also a very good one, but if you think about the expenses, it's actually inverted diagram. So actually self-care costs little, but if we didn't have self-care, it would cost a lot of money to the health systems. And we recently did a study in Europe where we looked at what would happen if non-prescription medicines were all subject to prescription, which meant that all people with the headaches, with the cough and cold would end up in the GP's office. Actually, primary care would collapse and every doctor would have to work 2.5 hours more every day to manage all those conditions. And I think we still have a great deal of things that are blocking our health systems because people are going there because of lack of health literacy or lack of awareness of certain minor ailments or certain conditions. Coming to the GP's office around this time of the year where it's cold and flu season and you will have a lot of people coughing and sneezing, that shouldn't be there in the first place. They should be in the pharmacy getting their self-care products and managing it at home and not spreading these diseases. So I think this is, again, as a self-care industry representative, our industry puts those products on the market and it's all that you find in the pharmacy without prescription. And we think that the potential of empowering more people to do the right thing, not only for themselves and their families, but also for health system, not clogging it, but rather doing their own self-care, would be an extremely powerful tool to release a lot of resources back into the health system and make it sort of more efficient. So this is how I see the value of the products that I represent, and I have to confess I'm also a qualified pharmacist. I really believe that there's a great deal that we can still do collectively in empowering our communities to do the right thing and to recognize when the health system resources should be spared to those that maybe need it more than we do.
Veronica, what policies or healthcare system change in Slovak or Europe to make the biggest difference in enabling patients likely to practice self-care effectively?
So, as I mentioned before, for example, IBD patients in Slovakia do not see only gastroenterologists, but also rheumatologists, dermatologists, etc. And it takes more time, and not everything is in the system. So it means when you go to the different specialists, Again, you are there for half an hour explaining what health issues you have, why it should be in the system, so it takes or it saves the time and of course the money. The second thing is that we also have a long waiting hours, so it means if you're going at the 7 o'clock in the morning and you are having a chronic disease, in the relapse situation, then you cannot wait for 5-6 hours. So then sometimes you leave, and what does it mean? In few maybe months or years, you need to be hospitalized, and the government needs to put more money to it. So again, the whole system or healthcare is a little bit. Not little bit much as a disaster in Slovakia, and we are facing these problems not only for IBD patients but different patients. And what is also there that we need the nurse who can help the doctor with a lot of things, not only as administration support, but also with educational procedures for patients. So, and this is what we also like in Slovakia. So I would say if there are really under legislation that every gastroenterologist has the nurse who can provide the education and then send us to psychologists or nutritionists, this is the easiest way how to manage the disease.
Christina, question for you. What role does teamwork and peer support play in the promotion of emotional well-being and reduce stress among caregivers of people with Alzheimer's disease?
So share responsibilities and distributing caregiving tasks reduce stress and emotional support. Colleagues can provide empathy, advice, and encouragement, helping to normalize challenges and reduce isolation. Peer learning and problem solving, sharing strategies of managing difficult behavior or situation can increase confidence and competence. Building sense of community, regular team meeting, support group, or drift-free session foster connection and reduce burnout.
I have a question about in what ways has the COVID pandemic reshaped public attitude towards self-care, and how can the sustain this momentum to improve mental resilience and physical health?
Yeah, so as I already briefly mentioned, I think COVID was sort of it gave a shockwave to the health systems and also to the society. So we were all asked to stay home, but we also were asked not to use health system resources unless it was really necessary, because we all understood that there were people who needed those resources much more than we did. And I think we have seen, I mean, my companies, for example, produce paracetamol. I can tell you that they were running 24-hour shifts because there was such a demand for a simple product that anyone who had a cold or flu or even a COVID was actually encouraged to take home unless they really needed to go into emergency care. So I think COVID was sort of a very good learning, which we also saw a very big demand and interest from people into also food supplement category. A lot of people wanted to know how they can strengthen their immunity, how they can actually stay away from being sick. So I think COVID also sort of made us aware that prevention is better than falling sick and needing care. And I think those learnings were really fantastic, but we see that they are sort of fading away and we are falling in our old habits. So I think there has to be an awareness from the policymaker side that we have to somewhat sustain some of that awareness and awareness about making sure that we use our health system resources logically and when we really need them, because we have a lot of people which health system have to care for. And selfishly, we sometimes need to actually do the right thing and go to talk to our pharmacist. But also thinking about the prevention is always better than care. And I think knowing that governments invest only 3 to 5%, and I mean 5 is the maximum in Europe, to prevention, this is really logical, because we should try to keep people from getting sick. And I talked a little bit about the value of nutrition and certain micronutrients that actually help people who have already some markers of potential chronic disease offset. They can actually sometimes be reversed with the right nutrition and with the right sort of supplementation. But also there are plenty of disease. If you have, for example, a cardiovascular disease, you know that flu is very dangerous for you. So everyone who has high blood pressure should be vaccinated, but we don't have the vaccine rates as it is. So I think there is still a lot of education to be done, and we need to rely on different, because we know that there's also a lot of conspiracy theories now in the system, etc. So we really have to rethink health education. And again, I talk back about, rather than trying to fix and put band-aids on our health systems, maybe we need to rethink them and build health systems where people are empowered to do the right thing, and where also maybe communities become the information sources. And that's why our industry is here today as well, is to talk to you as a community and talk about how we can help to make sure that you as patients can be seeing your doctors when you need them, and those people who can self-manage themselves, they do so. And I think COVID was really a strong driver for some of those changes, but we are not seeing them sustained. And the question is why.
Okay. And I'm looking at the clock and we are running out of time. And I see we have also 3 questions on online. And I want to give a possibility to ask questions from this room. So who wants to ask questions, raise a hand and we'll give you the microphone.
Yeah. I think self-care, I think we're all convinced that self-care is the way forward because the health systems cannot cope up with the number of patients. But I think there's a flip side to it, because if you rely too much on self-care and the patients are not empowered, they are not trained, they're not educated, I think there could be detrimental effect on patients. So my question to all of you, but perhaps related to you, is what is the industry doing to ensure that this doesn't happen, the care that's provided is safe? So what is the industry doing regarding that? And then my question maybe to the others would be what patient organizations can do to balance this issue.
So from industry side, I think we spend quite a lot of money on information, but I'm not sure if it's really reaching the addressee. And what the information I mean is that we provide very detailed product information with our products. So if you think about your non-prescription or any medicine pack, we provide a lengthy product information with it. And in the case of non-prescription medicines, you always will find if the systems persist, you have to consult your doctor. So I think as an industry, we know that we can provide support as long as it is a minor issue. And then if it becomes sort of persistent and you have weird symptoms coming up, you should be going and seeing your doctor. Unfortunately, only few people read the leaflets. So we are looking into the digital solutions. And one of the things that we are advocating as an industry, in addition to electronic leaflet, to have a digital leaflet. Because we would like the ChatGPTs of this world, rather than searching online, actually go into reliable sources, such as, for example, our information, which we have to legally provide, which is science-based, and we also do consumer testing. We have to sit down and test if information we provide is well understood. We would like this digital content to become sort of to feed into the ChatGPTs of this world, because no one these days Googles things. Everyone asks ChatGPT what to do. So I think we want now to provide this sort of next step into the making sure that people get the right information on how to deal with their symptoms, because that's what we are there for. And indeed, there might be some cases where people maybe do not go and see their doctor because they don't have time. However, this is something where I think, and this may be less relevant for European region, but they're in the countries where self-care is the only option you have. And I think this is where maybe self-care is better than no care. And I think this is where the subtle balance has to be made. And as an industry, I can promise you that we do not want our products to be abused and misused, because that challenges us. And normally regulators put it back on the prescription. So we are very much incentivized to make sure that products that we put on the market are effective, efficient, safe, and also more and more sustainable, because this is really something which can fill our business.
Yeah, I totally agree. And then also thinking about the negative impact of self-care when you can have all items at the pharmacy without prescription. Then now I'm thinking about chronic disease. Okay, now I'm having some flu or cold, so I take paracetamol or other things. And when I do it every second or third month, because my immune system is too low, so I get cold very easily, then it could have some bad effect in a few years on my liver, on my, I don't know which stomach, etc. So okay, the education is really here needed, because when you were talking about ChatGPT, he takes everything from what is online, what is website. So let's make a guideline, let's make an educational material that's strong, that everybody will look at your site. So then ChatGPT will promote, let's say, your website as the most relevant. Maybe this is the way.
Concern multiple sclerosis association in Portugal. How the industry see the digital market of prescription drugs. At the moment, we have been procured by patients that acquires their supplements online. And for many of them, sometimes they get suspicious if it is a real supplement or if it is something that is not adequate for them. So how can we, patient associations, help our patients in order to be correctly self-cared?
So I think you asked a very good question, because the digital or online marketplace is a Wild Wild West, and internet has no borders. So you can buy products that have not been authorized, you can buy products that are not authorized for your country, and this is a little bit the sad reality. How you as a patient can inform your community how to behave, the only thing I would suggest is that we have a regulation for non-prescription medicines, and I would apply the same logic for the food supplements. So any any channel that is authorized to sell non-prescription medicines in Europe has to carry a logo. It's a European approved logo, which says that this outlet has been certified by the regulator to sell non-prescription medicines. And this will be typically pharmacies. In some countries, it also could be supermarkets or other channels. Those outlets typically will sell non-prescription medicine, but also food supplements and other pharmacy products. So I would say look for the logo. It's a green cross, and that logo normally links also to the certified website, which lists, so it will be your regulator. And I know in Portugal a little bit, it will be Infarmed, listing all the authorized channels that can sell non-prescription medicines. And I would rely on this as a screening tool. Confidence that the regulator is behind, this outlet can sell self-care products, including food supplements. And this is the best advice I can give you, because otherwise you can forge websites, you can forge products, and there's no any other good, let's say, quality sign that you can put except the logo which we have. And it came through actually Falsified Medicines Directive. I work in Brussels and worked with this legislation. The Falsified Medicines Directive recognized the huge challenge that there is through illegal sale of the medicines, and it put this logo on. But benefit from it because it also sells all the other self-care products to you. So that would be something that I would suggest.
Thank you. And it's time to close the session. I think the session showed that the self-care isn't a luxury or add-on. It's a fundamental part of the. I think the session showed that the self-care isn't a luxury or add-on. It's a fundamental part of health. We talked about how countries should include self-care into their health policies instead of placing the full burden to individuals. We talked about digital tools, OTC medicines, and supplements can help people take more control, but fair access and quality still matters the most. Also, patient organizations like IBD or Alzheimer's associations turn broad ideas into real everyday support. They guide, motivate, and connect people. And the conclusion, I think is, at least for my point of view, is that take care of yourself with the same care you give the others. Start with your own well-being. If your glass is empty, you can't help anyone else. And the system should make that possible, not just promote self-care, but enable it in practice. Thank you, and enjoy that.